My name is Dr. Lee David and I'm a GP with an interest in mental health and cognitive behavioural therapy. And I'm here today to talk about anxiety, which is one of the commonest emotions experienced by people during times of crisis. Anxiety is usually triggered by some kind of threat, and COVID-19 brings numerous risks for health professionals and requires a constant awareness and vigilance which may trigger anxiety, exhaustion and burnout. There are risks to our own health and a fear of passing the infection to vulnerable family and friends, compounded by the physical strain of working with protective equipment, concerns about inadequate PPE, whilst coping with rapidly changing work environments, guidelines and new roles, and physical isolation during and after working hours. Some health professionals are going through traumatic experiences while providing care under extreme conditions, and some personality traits such as perfectionism, difficulties tolerating uncertainty, and over-internalisation of responsibility for patient outcomes can make it harder to adapt to these challenges. You'll be aware that anxiety and fear represent normal evolutionary reactions to threat as part of the fight or flight response, and I find it really helpful to use a CBT framework to map this process out into 5 key areas: thoughts, feelings and emotions, physical reactions, behaviour, and our environment. Thinking styles that worsen anxiety involve focusing on the worst possible outcomes, exaggerating and catastrophizing about the risks we're facing. And some anxious thinking is completely normal, but it shouldn't take up too much time or energy or involve getting stuck in a loop of anxious thoughts without problem solving or planning how to cope. People use many words to describe the emotions of anxiety, and it can be helpful to give a name to the feeling, just saying it aloud or thinking it in words. Right now I'm feeling anxious or scared, nervous, panicky. Labelling how we feel can start to make the feeling more understandable, and we may feel less out of control. It's also common to experience physical reactions, the sympathetic response. This may include shaking, sweating, palpitations, tightness in the chest, dizziness, and gastrointestinal symptoms. And while these symptoms can be unpleasant, they're not dangerous or harmful, and it can be helpful to remind yourself they're being triggered by anxiety and worry and will usually pass with time if you pause and wait. Typical behaviour in anxiety involves trying to avoid things that might trigger it, which is difficult at the moment where the news is filled with nothing but stories about the crisis. We might try to make ourselves feel safer by seeking reassurance or by checking, perhaps looking on the internet, checking numbers of cases, or checking the body for possible symptoms of illness. But many of these behaviours worsen anxiety as a vicious cycle, so repeated reassurance reduces people's belief in their own ability to cope, and constant reading and thinking about the crisis will make us feel more anxious. So how to cope with anxiety? Well, the first step involves general good self-care, monitoring yourself at work and at home, pacing your efforts, ensuring you eat regularly, keep hydrated, and schedule in brief breaks where you can. Doing a quick self-check-in. How am I doing today? What do I need? If you're tense and pent up, some physical activity or exercise may help to bring your emotions down and take your mind away from worry thoughts. If you're exhausted, agitated or restless, you might need to calm and soothe your emotions with a warm shower, practice some mindfulness, watching a relaxing TV program, or just taking a few slow breaths. Simply being aware that we're worrying, by acknowledging our emotions and by noticing and labelling worry thoughts, can help to provide a sense of distance and reduce their power. You can also keep anxious thoughts in perspective by asking yourself, is this way of thinking helpful? Is there a more balanced perspective? Can I take a helicopter view looking at the bigger picture? Cutting down unhelpful anxiety behaviours often involves setting limits to time spent reading and thinking about the crisis. So keep an eye on how often you watch the news, read updates, or interact with social media, and avoid doing this just before bed or in the middle of the night, which is likely to worsen sleep. It's a natural instinct to avoid things that make us uncomfortable, but in the long term, avoidance tends to increase anxiety, so it's best not to use alcohol or drugs, caffeine or sugar to try and mask or control unpleasant anxiety symptoms. Instead, talking about and sharing experiences with colleagues and others, seeking social support and building connection can help us to process any traumatic experiences. We can choose our actions based on what's important rather than trying to feel less anxious. This builds our confidence and belief in our ability to cope. We choose small actions, focusing on things that are within our control. And this might involve some self-compassion, being kind to ourselves and others, and letting go of rigid, perfectionist ideas about ourselves or the world. And the mnemonic ABLE can be a really helpful approach when struggling with anxiety or uncertainty. Acknowledge and allow what's happening. Notice when you're feeling a strong desire for certainty and give a name to the underlying thoughts and feelings. Allow these to be present without resisting or struggling to feel differently. Breathe. Take a deep breath and exhale slowly. Repeat this 3 to 5 times to create a pause and allow yourself time to decide what to do next. Let go of the thought or feeling about needing certainty. It will pass. You don't have to respond to it or act on it. You might imagine it floating away like a bubble or a cloud. Expand your attention and move back to doing something important with your full attention. And whilst anxiety is common and will affect most of us at some stage during this process, if it's having a significant impact on how you live your daily life, if it's affecting your ability to function at work or at home, and it's lasted for more than a few weeks, it may be time to seek help. And there are effective treatments and a variety of sources of help and support available for health professionals. So please seek help if you need it. It is available.